Hi, everyone. Thank you so much for joining this webinar with NHMA and GoodRx. I would like to introduce our first speaker, Dr. Gonzalez. Dr. Gonzalez, if you could introduce yourself and give a short bio, that would be great.
Absolutely. Well, thank you, GoodRx and National Hispanic Medical Association for having me. I'm based in New York. My name is Mauricio Gonzalez. I'm an internal and emergency medicine physician. I'm about to start working in the ER here in Manhattan, and I'm very passionate about preventive lifestyle.
Hello, everybody. I'm Dr. Mark Diaz. I am located in Sacramento, California. I trained in family medicine and occupational medicine, and I'm here moderating on behalf of NHMA. Happy to collaborate with GoodRx on this very interesting topic. I'm also the chairman of the National Hispanic Health Foundation, which provides scholarships to health profession students in pharmacy, medicine, dentistry, nursing, and public health. So we'll go on with the presentation and have Dr. Gonzalez take it away.
Thank you, Dr. Diaz. Okay, so let's start. I think before we move on with the slides, it's very important to just emphasize how truly relevant and important this topic is. And it might not sound like it for us physicians, but it's definitely a big deal for patients. You know, once you see your patients in your office and once they leave, a whole new universe of obstacles start. And I would say that probably the most common one is medication adherence. We know, based on current data, based on scientific studies, that adherence per se to any kind of treatment, it's hard to begin with. But when you add cost and problems with insurance companies and so on, the adherence goes down significantly. So I think it's very important for us doctors to be aware of these experiences that patients have after we see them. So let's start with adherence barriers. Next slide, please. As I said before, medication adherence is the extent to which patients take a medication as prescribed by their provider. Let's talk about a very common medication, statins, which are used to lower cholesterol. We know, based on studies in thousands and thousands of people, that after a year or so, the adherence to the medication goes down by 33%, which is bad because, these are life-saving medications. With these medications, we can reduce the incidence of heart disease by 30%. And the fact that adherence goes down is definitely not a good omen. But there are a multitude of reasons why patients fail to adhere to the prescribed medications. It's actually quite diverse. One is they don't have the proper education as to why they need to take it. That is very important. That's something that Dr. Diaz and myself would do, I would say, pretty much every day. No, it's not only about prescribing a medication, it's conveying the reason behind it. And once the patients understand the reason, it's easier for them to follow instructions. And obviously, and something that I personally been fighting on social media for 2 years is these inaccurate, irrational, or conflicting normative beliefs about medications. Like they're bad, they have side effects, So just imagine this universe for a patient. A universe where patients don't understand the reason, they have conflicting beliefs, and also medications are quite costly. So now we can start to understand why it's so difficult to create a good adherence. So I would say with confidence that if we address these three, we can make great improvements for all our patients, particularly the LatinX community. patients from the LatinX community. Next slide, please. So these are the common barriers affecting adherence: cost, healthcare deserts, and health literacy. It's very important to understand where we are in terms of healthcare literacy. The average American reads at 7th to 8th grade level. So just, let's ponder this for a second. This is significant. That means that our instructions have to be very concise, and they have to be very simple. And above all, we have to make repetition available. Every time we see the patients, we have to address the reason why we prescribe certain medications. In certain clinical trials, this has increased adherence to medications. Healthcare deserts. We know that 80% of the US population lives in a healthcare desert. So it's not only difficult to, obtain a medication, it's just difficult to obtain proper healthcare, period. And obviously cost. As previously mentioned, cost is the main reason why Americans fail to fill the prescriptions or receive treatment. I remember in the past when I was a young med student, I didn't care much about this. I thought it was not my job, or maybe it wasn't quite meaningful. Oh boy, I have changed my mind. This is quite meaningful. And you as a doctor, it's hard to say, but we do have the responsibility to address this in any way we can. And that's why I think GoodRx is probably one of the most beautiful tools that we have in healthcare nowadays. Next slide, please. I think a very easy to understand analogy on affordability, on medication affordability, is what we have been experiencing with the COVID-19 pandemic. Healthcare costs have been rising steadily, and prescription drugs are no exception. As prices increase and insurance cover less, patients are exposed to higher out-of-pocket costs. And we have to realize that for some people, an increase of 10, 12% in a medication might not mean anything. But for some people, it's a deal breaker. That 12% increase in a medication cost can be the difference between taking that medication or not taking it at all. So we have to be very cognizant about it. And nearly 40% of Americans struggle to afford the regular prescription medication. And obviously the COVID-19 pandemic has only made things worse. And this is even worse, this is even more terrible for the Latinx community. Why? It's pretty simple to understand. We have higher rates of diabetes, obesity, and other chronic diseases, which with time required more medications, and we were more prone to have COVID-19. So you can see that this is basically a double whammy. Oh, sorry, next slide. I think that, as I said earlier, the realities of life have to be part of a doctor's practice. Like even though we practice in a medical office, we live in a very globalized country, in a globalized world. And we have to be aware of the struggles that people face outside the medical office. And our patients, I'm sure Dr. Diaz has this experience, my patients are like too nice. They never say anything. It's like, hey, do you have any troubles with medications? No, Dr. Gonzalez, nothing at all. And then later on, you call them in 2 or 3 months and you speak to their family members and you realize that they didn't take the medications because they didn't have the money or they didn't understand why it was needed in the first place. So it is our job, it is our duty to make absolutely sure that our patients understand why they take medications. And if they have a problem with cost, we need to be aware of it, because sometimes we can change the medications or we can make sure we give them coupons like GoodRx, right? I mean, there's things that we can do. But if we don't ask those questions, we will never find out. This is a very interesting graphic. These are the changes in medication adherence due to prescription drug cost. So the question is, in the past year, which of the following adjustments to care have you made due to the cost of your prescription medications? And 18.7%, this is huge. This is truly huge. They say that they have delayed the refill after running out of meds. You know, if you think about metformin, okay, running out of metformin for a week or two, it's not ideal, right? But it might not be like truly, truly bad. But what if the patients are on blood thinners, right? And they have to delay this refill. It is life altering. So you ration, 16% answer that they ration their meds to extend the prescription. 13% switch to a more affordable alternative. But by the way, sometimes doctors, we can do that, but we need to know. That's what we need to ask. 11.5% stop taking a medication entirely. That's more than 1 out of every 10 patients. This cannot be happening. This can be happening. This is truly heartbreaking. Okay, next slide, please. And I think we can, I'm sure Dr. Diaz is more knowledgeable about this due to his entire career helping people in need, in truly need. And the social determinants of health, they have been acquiring this truly relevant amount of evidence in regards to human health. We actually have a very nice paper published in JAMA, I think 1 or 2 years ago, that showed in New York City, basically what matters the most to your health is your zip code, more than anything else. You can actually deduct years of life by moving from 50th Street to 100th Street, right? So social determinants of health are a pretty big reason why people suffer different healthcare outcomes. Next slide. There are a ton of concepts regarding social determinants of health, but these groups into 5 domains that the U.S. Department of Health and Human Services groups have provided. I find them quite useful and practical. Number 1, economic stability. A lot of the people have these very difficult situation where some days they have a job, sometimes they don't. Education access and quality, healthcare access and quality, neighborhood and built environment. This is something big that we don't pay attention close enough. Sometimes I tell my patients, you have to eat healthy, right? And you have to work out. Oh, really, doc? Where? Right? Where can I buy healthy food, or where can I exercise? Like, there's nothing around. And then you start realizing how important this is. And the social and community context. For some people, it's quite easy to call their doctors and say like, hey doc, I have this question about this medication. And then the doctors, they basically answer. But some patients, they don't have that access. And if you have questions pile up, right? And if you don't answer those in a timely fashion, medication adherence goes down too. So these are the social determinants of health, quite important for the modern doctor to be aware of. Next slide, please. Again, these are the 5 domains. This is just a confirmation slide. Economic stability, okay? People with steady employment are less likely to live in poverty and more likely to be healthy. You see, it has nothing to do with genes, right? Or decisions. This is basically about a socioeconomic issue, which, you know, it's very difficult to correct. Education access. People with higher levels of education are more likely to be healthier and live longer. Healthcare access. People without insurance are less likely to have a primary care provider, and they may not be able to afford their healthcare services and medications. Neighborhood and environment. Many people in the United States live in neighborhoods with high rates of violence, unsafe air or water. This, we experience it here in New York too, quite a bit. Social and community context, positive relationships at home, at work, you know, lack of domestic violence. And as I said, when you have a close communication with your doctor, this is truly important, because then you don't have answers, you don't have questions anymore. You get answers for your questions, and then you can go on with your treatment. Next slide. What about the Latinx community? This is something that I'm quite passionate about. That's basically, I would say, 90% of my work on social media and TV and, on my website and whatnot, videos, everything is about educating the Latinx community. We are a very, very diverse group of people. That's why it's very complex to address the Latinx community, as Dr. Diaz knows pretty well. Why? Because we have native born, we have foreign born, we have migrant workers, undocumented. This is like very diverse. So these human beings, they have sometimes quite opposite realities, like quite different. And so that's why it's very important to be culturally sensitive nowadays. But what I can tell you is that at the center of the Latinx community problems is basically chronic diseases, obesity, diabetes, hypertension, which ultimately leads to a higher incidence of certain types of cancer. And as we discussed before, this is not only about how healthy do you eat, how much exercise do you do, what kind of genes do you have. It's about access. It's about access. It's about comprehension. It's about work stability. It's about things that, unfortunately, doctors, we cannot provide. So that's why we need to be asking those questions, and we need to be addressing these issues in any way we can. Next slide. Yes, absolutely. We have to be cultural competent. This is something I'm sure Dr. Diaz teaches his med students every day about this. This is truly important. I gotta say that it's been a learning curve for me. Living in New York, I have patients from Egypt, Mexico, Colombia, Yemen, Senegal, from everywhere, China, obviously. So it's truly, it's an enrichment environment when you start to understand how you can address these communities. And once you become sensitive to their needs, to their ideas, you can see everything gets better. The confidence in the treatment, the adherence, everything. So what is cultural competency? It's the ability of healthcare providers and organizations to meet the cultural, social, and linguistic needs of their patients. Okay, just to give you a quick example, obviously I cannot know everything about all the cultures, but I love soccer and I know which cultures love soccer. So when I have a patient that is from Senegal, people from Senegal, they love soccer. That's how I start a conversation. Hey, do you like soccer? Oh, yes, I do. And so just knowing these little pieces of information, it can, create this more meaningful conversation. Of course, this is quite simple, right? But this is what cultural competency is all about, creating emotional connections to people of different communities. Okay, and this is United States. We have people from all over the world. It's very important for us to know this. And why does it matter? Because poor communication, as I said, between patients and healthcare workers act as a barrier to quality healthcare, period. It's that simple. If they don't understand you, if they don't feel you're sensitive, the adherence will go way down. And at the end of the day, that's what we do. We have to make sure patients get better. So by being culturally competent, we can increase that chance. Next slide. How to help your patients. Next slide. So I'm going to tell you my experience in the ER. And I got to tell you that I was introduced to GoodRx by one of my former attendings. Say, Mauricio, I remember it was probably the second week in the ER. Do you know if the patient have insurance? And I was like, no, you need to ask this. Otherwise, how do you know they're going to take the medications? And some of the medications we prescribe in the ER are, I'm going to say life-saving. Maybe antibiotics for an infection that can get worse if they don't take it, right? So I remember my attending told me, you have to tell them about GoodRx. You have to tell them that they can lower the cost of medication if they get a coupon, right? Or if they show this coupon to the pharmacist. Issues in communicating cost. If we don't talk about cost, we come across as doctors that we don't care. And that can be happening. We have to show the patients that we care, and we do care. And cost is part of it. Lack of knowledge regarding prices for treatments or prescriptions. I remember the first time I actually did some research and saw how much blood thinners cost. I was blown away. And then you get mad at patients because they don't take the medications, right? I remember that, how can you not be taking your medications? I was telling a patient with a clot in their lungs. And she was like, plain and simple, doctor, is really expensive. And then I look up the price and it was quite expensive. And I was like, oh my God, this is a life-saving medication, but it's truly costly. So it's very, very important. It's paramount. We have this discussion with the patients. The issues in communicating cost are basically lack of knowledge regarding prices, insufficient resources to educate patients on cost, and scarcity of time. And believe me, scarcity of time for me is a killer because I work in the ER and we basically have no time, not even to eat. So let alone discuss cost. Components of a cost conversation. What are the patient's acute financial needs? Do they have insurance? Do they have the means to pay the medication? Does the patient need assistance with budgeting or planning? Is it necessary to make a clinical decision where cost is a factor for the patient? I'm gonna go ahead and tell you something. At least in my practice in New York, we practice in the Upper East Side, very close to East Harlem. To me, it's a given. Like, my clinical decisions will always factor cost, always, all the time. Doesn't matter if the patient needs it or not. It's easier to think that way. It's because it's going to be simpler for you to take decisions, and that way you don't miss anything. Another problem that we've been seeing is that a lot of my patients are elderly, and sometimes they're elderly without family members around, and the only person they have around is a home health aide. And unfortunately, at least this is in New York, sometimes home health aides, they're not quite aware of the medications patients are taking, or they don't know about finances and insurance and blah, blah, blah. So sometimes it's extremely hard to obtain that information, even in a medical visit. So that's why I think that we should always, in our clinical decisions, factor in cost, always. Next slide. Now, how GoodRx can help? First of all is price transparency. I was talking with the GoodRx folks last week, and I was telling them that this is quite unique. This service is quite unique. I find it extremely helpful because it gives you transparency as to what kind of price different medications have. By lowering the cost of medications, you can improve adherence. As we discussed, it's a very complex problem, but at least by lowering the cost, you can definitely improve adherence. And if you improve adherence, well, something very nice to us happen, which is improving health outcomes. And most important, save time. So I would say, in a nutshell, the entire healthcare treatment flow gets way better by using GoodRx. Before we move on, I would like to mention this, which is truly, truly amazing, specifically when you work in a primary care clinic. GoodRx is a great resource to eliminate prior authorizations. I see Dr. Diaz is nodding and smiling because that can take, wow, an enormous amount of time. And just by GoodRx providing that specific service, it is just tremendously helpful. Next slide, please. Well, this is just an example of how to use the app. It's pretty intuitive. Basically, you just go in, you go to the search bar, you type the name of medications, you put your zip code, and it tells you how much it costs in different pharmacies around you. And if you want to share a coupon, you just click share and you send it via text, mail, however you want. I mean, it's incredibly easy. Next slide. This is, I don't know why I don't see the video, but there's a very nice add-on on the GoodRx app. So if you, oh, there you go. I still can see it, but I can tell you what it means. If you hit the search bar and you type the medication you need, you can go all the way down and you can click a part where it says manufacturer solutions. So it directs you to the manufacturer website and you can apply for coupons from the same industry without having to be digging around on Google and whatnot. You can do it through the GoodRx app, and this is a great resource. Next slide. We have Spanish resources now, which is phenomenal because we have to be culturally sensitive. And by providing resources in Spanish to our dear members of the LatinX community, this can also increase adherence. This is a very nice add-on from the GoodRx family. Next slide, please. This is just an example of how the GoodRx Spanish homepage looks like. Pretty nice. Deje de pagar tanto por sus medicamentos recetados. I love it. Okay, that's very nice. And it's quite simple to understand too. Next slide, please. Well, Sophie, if you don't mind, can you just return to the previous slide? Yes, this is very important. If you want to share the Spanish homepage to your patients, it's basically www.goodrx.com/es. And that's it. It's easy to remember. That's it, Sophie. Thank you. Next slide, please. To my taste, this is the best slide in the entire webinar because it shows you how much of a difference can GoodRx create in your patients. Just take a look at this. These are the most commonly prescribed medications nowadays, especially among the LatinX community, because we have higher incidence of obesity, diabetes, heart disease, hypertension. And these are medications that we prescribe every single day. Just take a look at atorvastatin, Lipitor. The retail price can be $128. And with a GoodRx discount can go to 21. That's an 83% discount. I mean, this has to make an impact in patients' lives, okay? You can see other ones like sildenafil from $150 to $14.67. I mean, you have to give your patients this resource. That's why it's very important, no matter what, just to go ahead and talk to all your patients about GoodRx. All of them. It doesn't matter. I'm sure 95% of them will benefit from it. Next slide. And that's it. I think this is just Q&A time.
Great discussion, Dr. Gonzalez. It's very illuminating. I think it's very helpful to our members to understand the importance of cost factors in terms of compliance. I think the last slide was very telling. And one of the things that wasn't on that slide is that for a given medication, through GoodRx, you can find maybe 5 or 10 pharmacies near your address that carry that medication. And some may vary by, $1 or $2 or something like that. The importance for for patients is that they may make that calculation in their head. I know you're in New York, people can ride the subway. Out in California or Texas, they have to drive to a pharmacy. And so when you're paying $5 a gallon for gasoline, you may want to make a cost comparison. Yeah, that may be cheaper at a pharmacy that's 10 miles away, but it may cost you that difference, that $2 difference, to drive there and drive back. So again, for them to be able to compare the prices and then the distance that they're going to have to travel to go to that pharmacy, I think that's something that they can factor in as well. And when you prescribe it, the same thing, because you can see many times on your EMR where these pharmacies are located. So I guess that answered that first question about how I use GoodRx in my day-to-day practice. As in terms of the next question that we have, there's what issues have I seen in that non-compliance leads to? Well, obviously, the patient can get sicker, or they can have a very bad outcome if they don't take their blood thinning medication, or they don't take their anti-anginal medication, or their antibiotics. But one thing that I thought about as you were giving the discussion is, as an experienced emergency room doctor, I know you don't have a lot of time to talk to the patients about it, but in the primary care clinics, what we see is patients who are non-compliant, not so much because they don't want to or they don't understand, but life gets in the way. So the grandmother is taking a medication, but the grandson is on drugs, or there's domestic violence issues. And so there are other things in their lives that take precedent over taking care of themselves. And I think if we have at least some discussion with patients about those social factors that are impacting on their non-compliance, that can also help improve compliance issue, maybe referring the patients to mental health services if necessary, things like that. I don't know if you've had that similar experience in the ER.
Yes, absolutely. I mean, not quite the same, because the primary care clinic has like very peculiar needs and cases. But in the ER, sometimes what happens is, let's say a patient goes and they have cellulitis, and then you prescribe a medication, an antibiotic, and then you call them 3 days later. Hey, how you doing? I was just calling to check in, see if you had any more problems. How's your antibiotic working? And it's truly frustrating and sad when I hear, well, I didn't take it. And then you ask why, and then you realize it's because the insurance didn't cover it, or they didn't have the money, and they didn't want to go back to the ER to ask me what other medication can. So that's why it's very important that once the patient leaves the ER, at least in my case, they know about GoodRx, because that way, it won't solve all the problems in the world, but at least it will solve the issue of cost, or at least reduce it.
Right. And going back to GoodRx, are there any other programs that help patients for their medications through GoodRx?
Are there any additional? I think, Dr. Diaz, you have a better answer for that, right?
Yes, there is on the GoodRx website, there's a page that shows certain community clinics that are able to access a GoodRx program that provides medications for patients for a certain limited period of time. Those clinics are accepted to the program on a periodic basis once a year, and anyone who's interested can go to that webpage and sign up on the email list, and then get information when the program is open for application for a given community clinic or primary care clinic. Let's see. And of course, I think we can both agree that the GoodRx programs have had an outstanding effect on our practices in terms of compliance by getting or helping patients afford their medications. The kind of going back to my prior comments, there's a GoodRx medication assistance program and community clinics that are currently enrolled in the program. I have worked quite a number of years at the second one on the list, Clínica de Pati in Sacramento, California, and I can attest to the value of the program, that program, and just the plain generic GoodRx program in terms of getting medications to our patients in order to improve compliance. And I'm going to put in the chat another resource that's available that you can go to on a website, and it lists quite a few pharmaceutical company and other foundations that provide patient assistance to people who can't afford their medication. So I'll put that in right now, and I think we'll open it up to our viewers who have questions about the GoodRx program or any comments they might have.
Dr. Diaz, before we move on, I just want to point something out. The third or fourth question was what other resources you can use for the LatinX community. I just wanted to say that the CDC website is a tremendous tool that unfortunately it's quite underutilized. It has pretty much all the resources for lifestyle, for exercise, medication adherence. It has resources for healthy recipes, all of them in Spanish with very nice free PDFs that people can download. It's just an amazing resource that sometimes we don't use enough. So if someone is listening and they're passionate about nutrition, exercise, and behavior modification, the CDC website is a tremendous resource.
Yes, Dr. Gonzalez, I totally agree with that. I know the CDC has quite a few resources there, and just a minor sidelight, that it also includes the information that's necessary for the I-693 form for people who are transitioning on immigration. And so for us physicians that are involved in doing that, or just for the patients who want to know what is going to be required, they can go look up the technical requirements for passing their examination and proceeding with their immigration status.
Right. Dr. Diaz, how big of an impact has GoodRx has on your practice?
It's been a tremendous impact in terms of providing great cost information to patients, and certainly in the free clinic that I work at, to be able to provide medication assistance to patients is excellent. Many of the pharmaceutical patient assistance programs have a requirement that the patients are legal residents or citizens of the United States. I don't know why they have that requirement, but the GoodRx program does not have that requirement, which again is just a godsend for our patients, some of whom are not documented or in the process of getting documentation. And they're fearful of asking for any kind of government assistance because that may impinge on their ability to regularize their immigration status. And so again, that's one of those factors that leads to non-compliance because they don't want to deal with the federal government, but rightly so for their goals and their needs.
Absolutely. Absolutely. I think from my end, GoodRx has had a tremendous impact. And sometimes it's hard to assess how much, right? Because you send a prescription to a patient, that you send a coupon with them, a GoodRx coupon, and they just get the medication for a cheaper cost. So sometimes they didn't have the comparison as to how much would have cost otherwise without the GoodRx coupon. But it is part of my practice. I gotta tell you, I basically give the GoodRx coupons to all my patients, no matter what. It is definitely part of the care that I provide.
That's great. And we have some additional comments for information regarding the Latinx community. People can go to the hispanichealth.info website, which is also a great resource for information. And there's a question there about what would GoodRx 2.0 look like?
I don't know. That's a great question.
Same here. I'm not sure what it might look like, but it's pretty darn good right now.
Right, exactly.
And if they can improve it, it's even better. Hopefully, this program, the GoodRx programs, will encourage the pharmaceutical companies to be more realistic about what they charge for their medications, and perhaps drive Wall Street out of the pharmaceutical business.
Absolutely. Absolutely. I mean, at this point, I don't know how GoodRx can be better because they provide a tremendous service, but I guess there's always room for improvement. There's a question from Adriana Garcia. I don't know if you want to answer it, Dr. Diaz, or it's from
yeah, it's either way. So either as a doctor, you can provide the GoodRx coupons. I know I get a box full of coupons periodically from GoodRx, but at the point of contact with the patient, you can look up the medication and print out a coupon if you want, or the patient can go home and print out a coupon on their own. I think all of those work to provide the patients with the coupons.
Right. So in my experience, I always have coupons available to me. So basically, I always hand them to my patients. So my patients leave with a coupon already. And if I don't have them with me, I basically text them the coupon. But in my experience, it's better if they walk out of the ER with the coupon already in their hands. That's my experience. It's always easier.
Right. This is the stack of GoodRx coupons that I get in the mail. I don't end up using them because in our clinic, the students we have a pharmacy clinic committee, and they automatically plug the patients into GoodRx.
Wow, that's amazing.
Yeah.
On an additional note there that I just want to add from a GoodRx, and when you give a patient the card and coupon, I love Dr. Diaz and Dr. Gonzalez, you have the cards ready to go. There is a link in the chat to order the cards for free to your office. But additionally, when they use the coupon at the pharmacy, that coupon actually gets saved to their profile at the pharmacy. So if they go to pick up that same prescription, the pharmacy can automatically apply that same discount.
Yep, I forgot to mention that. Thank you, Sarah. That's actually quite useful, especially for medications that, recurrent medications like metformin, atorvastatin, amlodipine, these medications that we prescribe every month. Yeah.
So those, once it's on file with the pharmacy, that discount does not expire, if you will?
No, it does not expire, but it should be around the same price, just as drug pricing, as we all know, is a big ball game. It should say that about the same price, but yes, automatically applied.
Great, excellent. We still have time for a few more questions if any of the viewers want to send in the question or to the Q&A. We'll give folks another minute or two to come up with a question if they have any. I don't know if you have any additional comments about GoodRx program or costs in general, Dr. Gonzalez?
No. I think we touch upon all the aspects about cost of care, and no additional comments. Do you have a success? There's another question.
Mm-hmm.
Do you have a success, life-changing story you want to share about patient for GoodRx? I mean, I do. The thing is, GoodRx, it's basically part of our lives. And I'm sure we have life-changing stories every single day. It's just that we don't hear about them, right? Because by using the GoodRx coupons, you prevent the problem in the first place. You see, if you discharge a patient from the ER without a coupon and they can't get the medication because it's too costly, they might never come back to see you. The disease can progress and they can go to another ER, and the other ER physicians deal with the complications and never you hear about it. So every time you discharge a patient with a coupon, with a GoodRx coupon, it's already a life-changing story. I mean, it might sound more noisy than what it is, but it's true. Just by lowering cost, you're making a great impact. To my mind, it comes, I had a patient who basically was visiting from outside the country, was visiting family members in New York. And this patient had this very, very peculiar condition where their blood pressure drops or goes super high, and their heart rate goes up, goes down, and they need a very specific medication. And they lost that medication. And we were able to provide that medication from the ER. And we used a coupon, a GoodRx coupon, and the price went down, I don't know, by 63-70%. And yeah, just imagine. And that's just one common human being in New York. This happens every single day here. So there's plenty of stories like that one. Thank you. Exactly. Excellence is the only option. Thank you. Okay, I guess we can wrap up.
Well, I was going to to just mention an experience that I had with a patient who
Mhm.
required Infed, which is a iron solution, and this patient needed to get quite a bit of it, and so the amount that he needed was in the range of $300, and that's with the discount. And so knowing which pharmacy had the lowest price using GoodRx made quite a difference in terms of whether the patient was going to be able to afford the medication, which in his case is life-saving, because otherwise, with his hematological condition that he has, he becomes severely anemic with the recorded, I don't know how he did this, a recorded hemoglobin of 5. And so, I think this is really important to be able to provide these medications. So once again, I'd like to thank Dr. Gonzalez for a very a great discussion of medications. Whoops, somebody just put in a question there about GoodRx in terms of it being a nonprofit. And I'm not sure if it's a nonprofit organization or not. You know, Dr. Gonzalez?
I'm not sure.
I can go ahead and answer that question just for some context. GoodRx, we are not a nonprofit. We do have a large philanthropic branch called GoodRx Helps, which every single quarter we are now donating $25,000 on a quarter. Within employees in GoodRx Helps, we have a huge foundation where we have millions and millions of dollars going to philanthropy. But no, we are not a nonprofit organization.
Thank you.
Of course, the pharmaceutical companies are also not nonprofit organizations. So it's still a great program, however it's financed. It definitely helps patients and patient compliance. So, so again, I want to thank Dr. Gonzalez for an excellent presentation. Oh man, now everybody has questions. Yes, GoodRx is available in rural areas. And what else here? The chat has the web link for the social impact of GoodRx, if people want to go to that. So you can just go to the GoodRx website and find out much more about GoodRx if you'd like to, if you have an interest. Again, let me see if we think we've got all our questions answered. And, you know, it's been a pleasure hosting this event with NHMA and GoodRx cooperating and having Dr. Gonzalez talk to us about cost savings for our patients, which leads to greater compliance, which presumably leads to better health outcomes for our patients. So I'd like to thank all the attendees and wishing you a great rest of your day. So
Thank you.
that's it. All right.